Hi, and welcome to the first episode of the Vet Dental Show. This is for veterinarians and technicians as a team in dentistry service to help you to navigate through all the ins and outs of dentistry in your general practice. And we're going to start this off great. We're going to start it off with a challenge or a giveaway. We have 3 Luxator elevator sets that we're going to be giving away on the 4th episode. And these Luxator and elevator sets are color coded and they're top quality. They were designed by yours truly, and I use them daily in my practice. So those are of about a $500 value. We're going to give 3 away. And the way to win those, if you haven't already done it, subscribe to us on iTunes or on YouTube, and you'll get different points for that. And the way that you do that is go to veterinarydentistry.net, not .com, veterinarydentistry.net/podcast on your mobile device, and just hit subscribe to iTunes, and then go to iTunes and subscribe. Once you hit that button, it'll take you to the page to hit subscribe, and that'll give you 10 chances to win. And then if you subscribe to our YouTube channel, you'll also get 3 chances to win. And then we'd hope that you share that with your colleagues on social as well. So today's episode, we're going to go through some basic things for the veterinary and technician team in the dentistry service, and kind of walk you through some of the most important things in general practice that you can do to get that dentistry service up and running quickly and efficiently. A lot of our dentistry services in general practice are not at the level that they're really efficient, and that's understandable because there's a certain formula that you really need to use to get to that point where you can actually put these things in place as action items and get them going in your practice. So it's important to understand first what the actual setup is as far as the veterinarian and technician team and their roles. So the 2 primary components of the dentistry service is a technician that knows how to chart and knows how to take dental radiographs quickly and efficiently. The other component of that is a veterinarian that is well versed in radiographic interpretation and can take that interpretation and put it directly into an actionable plan, and then proceed to doing that plan or performing that plan on the patient until completion. And when we talk about those surgical extractions, that is probably 85% of what you do in general practice if you're practicing at that quality level. And we're talking about for any tooth, it doesn't matter if it's mobile or if it's completely immobile, we're going to open a flap and we're going to extract that tooth, and then we're going to clean out everything in there with our diamond football burr, clean up the gingiva as much as we can, and then close that in a primary closure so that there's no voids in the alveoli, and we've got a nice, clean, disease-free mouth wherever we have periodontal disease to begin with. So that's the main thing that you guys deal with in practice is periodontal disease. And with that said, when you are doing these procedures, you want to get through as quickly as possible, as efficiently as possible. So the technician should strive to be able to take full mouth radiographs in a small dog or cat in 8 minutes or less. In a large dog, 15 minutes or less. So those are your parameters that you're shooting for. And the best thing to do is practice on a cadaver. Get a cadaver. You can get them at Skulls Unlimited. You can get them at Carolina Biological Supply. Keep them frozen. Thaw them out a day and a half or 2 days ahead of time, and then use those to practice and get really good. And it only takes 1 or 2 sessions of a couple hours doing those radiographs in order to get really good. And then that translates to the patient exponentially for the rest of the dentistry service existence, and gets that patient out much quicker than having to fumble around with radiographs and then the veterinarian having to wait on those until they can interpret them. So the technician plays a huge role in the efficiency in that service. And then I've already described the veterinarian. The veterinarian can gain skills and knowledge in that field with various courses that we have and others do as well. We actually have virtual extraction courses, and we'll talk about those in a later episode. But with that being said, getting to that level of proficiency and efficiency is absolutely key in practice. And the way to start doing that is to take a step-by-step approach and do things in the same order. So let me describe what that order should be. And the first thing that we do is we intubate the patient, right, after we've induced them, and that patient's going to be in sternal recumbency. So why not leave them in sternal recumbency and take all the maxillary radiographs first, turn the patient over, take all the mandibular radiographs first, and then proceed with allowing the veterinarian to interpret those and chart the findings. Then once you've done the radiographs, you know which teeth you're going to extract. So you extract, you don't have to chart the teeth that you're going to extract. Those can be designated as PD 2, 3, or 4, periodontal disease 2, 3, or 4, based on the level of bone destruction around the tooth root. So we're not going back and probing those teeth we're going to extract again, so there's no reason to have probing depths around them. All you need is that one designation, so that saves a huge amount of time. The other thing that you don't do with those teeth that you're going to extract, you do not clean them. That is a total waste of anesthesia time, and you don't have to worry about cleaning those. You just want to clean the teeth that you're going to extract, or you're not going to extract, excuse me. And then once those teeth are clean, you can go back and you can finish your charting. And before you do that, you can call the owner and let them know we have this many extractions, and those extractions will be this much. We are still cleaning. We want the veterinarian to get started right away after we clean. So we may find some things after we clean, but here's the estimate, and get permission to go forward. At that point, you can do your nerve blocks. And then once the cleaning and the charting is done, the veterinarian can get in and start right away. So that's the progression that you want to take to get to the point where you're quick and efficient, and you can minimize the anesthesia time with these patients. So that's our episode for today. Again, please subscribe on iTunes if you haven't already, or on YouTube, or wherever you listen, Spotify, Stitcher, wherever you listen to podcasts. Please subscribe to help us get the word out and help more veterinarians in general practice. So again, that if you have not already done so to enter that contest to win those 3 luxating elevators, or one of those 3 luxating elevator sets, then please do at veterinarydentistry.net/podcast, and we'll see you next time. Take care.